Welcome to Real Health with me, Carl Henry. Folks, on today's podcast, we are joined by Martina Blake, National Lead for the HSE Tobacco Free Ireland programme. Vaping is increasingly common, especially and worryingly amongst young people. And while it's often seen as a safer alternative to smoking, there are real concerns around nicotine addiction, lung health, mental well-being and regulation. In this episode, we explore what vaping actually is, how it affects the body, what we know, what we don't know, about the long-term risks and the supports available for people who want to quit. Martina, welcome.
Thank you very much.
I'm looking forward to this topic.
Great.
I think it's really important.
Yeah, I suppose it's a topic that a lot of people are interested in because we've seen a huge growth in the number of both adults and particularly young people who are vaping. And I suppose, I work in Tobacco Free Ireland, so our work is around, reducing smoking prevalence. But the phenomenon of vaping has hampered and stalled our progress in terms of achieving a tobacco-free Ireland. So the HRB, the Health Research Board, did a study a number of years ago and looked at whether or not e-cigarettes were helpful in smoking cessation and what impact they had in terms of smoking initiation. And they found that young people who started to vape were 3 to 5 times more likely to go on to smoke later in life.
Wow.
Yeah. And they obviously looked at the harms versus benefits of e-cigarettes as well. So we looked at them before we made these new clinical guidelines and recommendations around what works in terms of stop smoking care. And some of the studies showed that e-cigarettes were helping some people to quit smoking, but at a population level, they haven't helped. So they've stalled our smoking prevalence rates, and they're also harmful in and of themselves. And we could talk a little bit more about that specifically. Mm-hmm. So we decided not to recommend them as a stop smoking aid in our clinical guidelines because we had 2 products. We had nicotine replacement therapy, which we know is licensed medicine that's safe and has, decades of trials. And we had e-cigarettes on the other hand, which had some small number of studies that said that they might be effective, but they were harmful in and of themselves. And then there was the risk of youth use, which we have seen. Yeah.
And when did vaping start? When did it come in? Because it's everywhere now.
It's pretty much everywhere now. So I suppose the real growth started kind of 2015, 2016 here. But, it was invented in China a number of years before that as a stop smoking aid, actually, by a scientist over there. But I suppose the real growth has happened in the last 9 to 10 years. The tobacco industry have purchased the vape industry, the companies that produce vapes and are very interested in this space because they can see the move away from tobacco. People are interested in their health a bit more, a bit more aware of the harms of smoking. And the tobacco industry are interested in profit, obviously, and, targeting the next generation of children for the next new thing. So, most of the industry is controlled by the tobacco industry. So they're producing loads of different types of products. There's even new products to provide nicotine, like nicotine gummy sweets, nicotine gel, that you can put on your skin, nicotine toothpicks, nicotine pouches and vapes. So they're diversifying.
And specifically